Hey everybody, this is Manny Moustakakis coming live from New York Presbyterian Hospital in Flushing, New York and Queens. This is my home base, this is where I work, and I'm coming today in honor of Go Red for Women Day. It's the American Heart Association's initiative to raise awareness of heart disease in women. Most people understand heart disease to be a disease of men. They think it's mostly a man's disease, but that's just not true. The statistics are very real. Heart disease remains this year and for all years in recent past the #1 killer of women, and basically at all age levels. It actually is true that heart disease kills more women every year in the United States than all forms of cancer combined. And so Go Red is an initiative from the AHA to raise awareness of that fact. So what I want to talk about today for a couple of minutes is a few topics. Number one, the risk factors for heart disease, and coronary heart disease in particular is my area of expertise. Risk factors for coronary disease are basically in two categories. One is the things that you can do something about. So things like high blood pressure, high cholesterol, diabetes, kidney disease, obesity if you're overweight, and certainly smoking, probably the biggest one. The things you can't do anything about, there's some risk factors there too. Certainly a family history of heart disease in your parents and brothers and sisters. And if you've ever had heart disease or a heart attack or a stroke in the past, those would be other risk factors for heart disease. What can you do? Well, certainly you can talk to your doctor, your primary care doctor, a cardiologist, about understanding your own numbers. Knowing your blood pressure, knowing your cholesterol numbers is really important. Knowing your sugar is important. Knowing your body mass index is important. What about things that you can do to reduce your risk factors? Well, certainly some of them seem quite obvious. Like if you're a smoker, it's a good idea to quit smoking. Certainly losing weight, regular exercise, eating healthy, those are all the kinds of things that you can talk to your doctor about. And then last couple of things I want to do is talk about where you can get more information. So GoRedForWomen.org is one great place to get information. Certainly the American Heart Association website is another great place for information on signs of a heart attack and risk factors and so forth. And obviously you can comment here. If you want to get information, feel free to comment here, and I'm happy to answer as many of you who want to comment. Just by way of finishing this up, I want to talk about some of the signs and symptoms that you can expect to see sometimes in women who might be having heart disease or a heart attack in particular, because a lot of times we think about the heart attack like you see it in the movies. Some guy is clutching his chest in pain and writhing around in pain, but it could be a lot different than that. And classically in women, sometimes it's very different than that. So some of the signs of heart attack, particularly in women, it certainly could be the classic pain in the middle of your chest, like an elephant sitting on your chest, but it could be a lot of other things. So it could be anything from throat pain and jaw pain and arm pain. It could be abdominal pain. It could just be sudden shortness of breath and profuse sweating. The bottom line is, if anything in your chest just doesn't feel right, take it seriously. The youngest woman that I ever worked on having a heart attack was 20 years old, and the oldest was 102 years old. And so certainly I've seen it myself. We've all in the health community, in the healthcare community, have seen it over and over at very young ages. So the bottom line is, what should you do if you think you might be having a heart attack? Absolutely, you should get to the nearest emergency room as fast as you can. I always recommend calling 911 and coming by ambulance, because the reality is that bad things can happen on your way to the hospital. If you had a cardiac arrest, a paramedic could be trained to resuscitate you if something bad happened before you got to the hospital. Paramedics also have lights and sirens that can cut through traffic. So here I am in downtown Flushing, New York. There's a lot of traffic here all the time, and lights and sirens cut through that traffic. And they can also, frankly, call ahead to an ER. If you are having a heart attack, they can call ahead and warn them that you're coming. So I hope that you guys found this helpful, and I thank you for watching. And if you want to comment and let me know where you're watching from, I appreciate it. And if you have any questions, I appreciate it, and certainly I hope you'll share this with the women in your life, and have a great day. I got to get back to work. I'd love to show you what goes on inside the cath lab where I work, but we got a lot of patients in there, and for obvious federal privacy protections, I can't take you inside the cath lab. But have a wonderful day. Happy Go Red for Women Day, and love the women in your life. Thanks a lot, everybody.